The RehaCom module Saccadic training trains rapid jumping eye movements. It is appropriate for patients with visual field impairments or visual neglect. Training the saccade increases the visual search area. The visual field impairment can be partly compensated. The training with this module is indicated for patients with impairments of the visual field or a visual neglect after stroke, traumatic brain injury, brain tumour, and multiple sclerosis. The saccadic training should start immediately after the diagnosis of hemianopia or visual neglect respectively. Before starting the training module, it is possible to individualize the training parameters. Via the therapist menu, one can adjust the level of difficulty, duration of session, instructions and help or stressors according to the patient's needs. It is possible to change these parameters at any time during the training. The task in this module is to perceive visual stimuli and to react on them as quickly as possible. The patient should sit in front of a large monitor, a minimum of 19 inches, and focus on the fixation point in the middle of the screen. An acoustic signal will sound and an object will appear on the screen. The patient will now scan the screen with his eyes as fast as possible and look for the presented object. For objects positioned on the left side of the fixation point, the patient should push the left arrow button. And for objects positioned on the right side of the fixation point, the right arrow button. It is recommended to use a chin rest to avoid the patient's head moving. The training starts with large objects presented close to the centre. They are shown in high contrast, and there is an auxiliary line to support the orientation. With rising difficulty, the objects will become smaller and more widely spaced on the screen. They will be shown in less contrast, and the auxiliary line will vanish. For patients with neglect, additional optokinetic stimulation can be switched on. RehaCom works auto-adaptively. The difficulty level will rise or fall depending on the patient's performance. With each change in level, the user will receive additional feedback. At the end of a training session, RehaCom will create an evaluation graph. Training results will always be saved automatically, and the patient will continue from this stage when starting the next training session. Please find further information on our website.